Bismillahirrahmanirrahim. Syed Shah, Minister for Planning and Development, Dr. Azraf H.O., Minister of Health, Mr. Naji, Country Director, World Bank, Ms. Nicole Klingon, World Bank Regional Director for Human Development for the South Asia region, administrative secretaries, other stakeholders, people from the national organization, ladies and gentlemen, Assalamu alaikum. As I believe all have said before, it's an important event that I've been asked to come, but again, it's a sad event. I remember about 10 years ago, the then President of the World Bank, Mr. Jim Kim, had come to Karachi and he talked about stunting. At that time, we developed or we created this cell in the Planning and Development Department and made a lot of efforts, but unfortunately, I'd admit we failed. We failed in the last 10 years, and we need to learn from the mistakes that we made. You've seen, I'm very grateful to Dr. Ghazala Mansouri for giving us a very insightful presentation here today. I'll take a copy of this and try and learn more about it. And other countries have done it, and as Naji said, rich countries, poor countries, big countries, small countries, it's across the board. If they have done it, I don't know where we have gone wrong. We have tried. I congratulate the Department of Planning and Development for organizing this workshop. As rightly said, it's called Multi-sectorial Convergence Strategies on Stunting and Malnutrition in Sindh. It is multi-sectoral, there's no doubt about it. That's why we housed it in the Planning and Development Department. The key other departments, obviously Health Minister is here. I don't know if the Public Health Secretary is here or not. He's not here. The most important department, as we've all talked about, and he's not here, Chief Secretary Sahab, if you can get him here now, right now, so that at least he becomes part of the workshop from now onwards. And I can talk about what we've tried to do because we've not done it. As I told you, 10 years ago, almost 10 years ago, we created this special cell in the Planning and Development Department. We also got an ex-bureaucrat who was highly recommended to head that team. That, admit that he wasn't successful, otherwise we would not have been standing here today. We would have been celebrating at least a 50% reduction, as you say. Countries have done that. From 66%, if we were 33% today, we would have been happier, but we've actually done worse than before. We've taken steps. Now we need to go back and see what we're doing wrong. We had this wash facility. I'm very grateful to the World Bank. I'm grateful to other international agencies who came in at that time. And I remember when we started the stunting program, the World Bank took the lead. The European Union came in. There were several other international agencies, because this is not, obviously it's a Sindh problem, but it's a global problem. We claim that we have a very young, dynamic, young population which can take us to the future. I've seen some, actually the growth numbers that you showed, Dr. Azalat. Somebody sent me a few days ago where Pakistan had become by 2075 the sixth largest economy, or the fourth largest, not the sixth, the third or fourth largest economy, and they were counting on the number of workers that we had, the youth. But if 2/3 of our youth is not able to work, we're not going to get there. So it is time for us to really think. We've tried. I'm not saying we've not tried. The WASH program, the public health engineering started doing, and I'll tell you, my colleagues here would all know, and I'm sure all of you would know, our chairman, Bilawal Bhutto Zardari, during his election campaign, has laid the highest stress on drinking water. Good drinking water, and I've told everybody, the minister knows that from now on, the most important sector that we're going to do is provide clean drinking water to the entire population of Sindh, and this is what we want to do at the end of this term. And if we are able to achieve that, I think we'll have done a great service to this province and the country. We've got the 1,000-day program under the Social Protection Department. It is rolled out, it's slow, but I took a meeting 2 days ago of the board, and hopefully we will meet our, we are behind the targets right now in terms of the number of pregnant ladies that we register. But we are well on our way. We started late, but we'll pick up, and inshallah we'll achieve those targets. I hope so. It's been expanded to what, 24 districts in the 15 districts, sorry, but we need to go to all 30 districts of the province. But again, these kinds of programs we've been doing before. We've got the Benazir Income Support Program, the Nashonuma scheme that they have, but somehow or the other they are not getting together, otherwise we would not have had this result. So let's all, and I hope the workshop here today identifies the shortcomings, identifies what we've been doing wrong, and guides the government, and want the experts to guide us, to tell us what to do, so that hopefully, a year from now we can have a follow-up and see whether we've achieved what we've done. This is not a short term, we can't do this. I can't say take a meeting every week and see where we are. But let's make a pledge that a year from today, we'll all get together in this room or in a similar room and see whether we've been able to, whether we are on track or not. We need to monitor it that way, and I'd request our donors, especially the World Bank, who've been helping us in this and in all our other, I've not mentioned this, I've mentioned this enough, but I'll do it again, the help that we've got from the World Bank, especially after the 2022 flood. If the bank had not supported us, we would have been in much graver problems than today. So appreciate the World Bank for what they have been doing, but let's now target this problem that we have. Ms. Nicole, I'm grateful that you've come over, and I request that you come over again a year from today. And Dr. Ghazala will, I'll try and have a meeting with you and get our people together so that we, you've told us the problem, but you haven't told us the solution as yet. So that solution is what we need to know. So again, I'll tell the Planning and Development Department that it's a very timely workshop that they've done. Not timely, it's actually 10 years too late, and I have myself to blame for that, nobody else. But the minister has taken this lead. I'd like that we really focus on this. All the stakeholders, Madam Health Minister is very keen, but we need to, and we've done, I'm proud of what we've done in the health department, but we do need to go down to the primary health and address that issue now. Because the dispensaries, the basic health units, they need to be able to provide the necessary, not only the health facilities, but the necessary, the training, what Dr. Ghazala talked about, the low-hanging fruit. Our lady health workers, we've been using them for polio and for all other things, but this should be added to their mandate, that their job description, that they should talk about stunting and how to do their bit to reduce it. So, inshallah, I hope that a year from now, we will be in a position where we're not that sad as we are today. We have more smiling faces. Once again, I'm grateful to the Planning and Development Department and the World Bank for organizing this workshop. And as I said, we hope that we get something out of it. I'd request, I believe you have the technical sessions in the second half after the tea break. So if the findings or the recommendations of this technical sessions are sent to my office, Office of the Chief Secretary, so that we can follow up with all the different departments and implement the recommendations, and inshallah a year from now we sit here with more smiling faces. Thank you very much.